Lolo, Ekako, yeah. Baby, what the kako? You katana, no. Give your leg back, plumb me. Lolo, ya the kako, yeah. Oh, hey. Binami, what the kako? Lolo, hey. Lolo, hey. Lolo, hey. Lolo, hey. Oh, oh, oh. Lenye be ya me wo kata lenya bon blole wo mutila. Yeah, ya nya de kako ye. Me tibe mafia. Is there a place for the hopeless sinner who has hurt all mankind just to save his own? Believe it.
Hello there, welcome to Trend Africa, where we give you the best of live streaming across all states in the US. We also do web designing, event planning, MCing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Good evening to all and welcome to another exciting episode of Health Talks. My name is Dr. Araba and I am your host for this program. Health Talks is proudly brought to us by Trend Africa TV and Ghana National Council, and we are sponsored by the Jemima Nunu Foundation, Omama TV, Holiday Africa, and Art Banks. I'd like to give you a little bit of time to share the feed. Tell a friend to tell a friend that Health Talks is on. We'll be right back. Thank you.
Netovi me la siwode la beme agbagbe fu kakakakale mawunya yeble na mibe ilomya me mawunya efya mibe ilomya me agbe oh yeah, agbenyenu.
Looking for that special gift for that special someone? Looking to bring life into your personal or family portraits? Bank is your creative bank of art solutions. We provide a wide range of digital photo editing and paintings that will transform your images into exquisite yet affordable pieces of art. We bring old photos back to life. Your photos can be framed or made into canvas prints of any size of your choice. Our ultimate goal is to bring into your homes and offices a amazing masterpieces through eye-catching portrait paintings for occasions such as birthdays, graduations, award ceremonies, funerals, and many more. You can locate us on Instagram at @bankgh. You can also contact us on 312-609-9907 or at bankgh@gmail.com for all your inquiries. At Bank, reviving your images.
Thank you so much for choosing to trust us and for your interest in learning more about Flurry. You might probably be wondering, why has this never existed before? Why have other people not attempted it? That answer could be a lot of different things. But it's important for me to share with you why Flurry is my passion and why I would go to the ends of the world to make sure that your loved ones are protected. 2 years ago, I lost my grandmother in the most unfortunate situation. She needed care in Ghana, but never had the infrastructure, even though we sent money to her, to be able to make the right choices and access the care she needed and deserved. I don't want that to happen to you. A year ago, I went through a very traumatic experience. My mother had fallen sick on her birthday. She had a mini heart attack. She was taken to the hospital, but like every other African mother, did not want me to worry. For 2 days, I had no idea that she was fighting for her life. If not for a friend who happened to be a doctor taking interest in her at the hospital she was taken to in Ghana, we probably would have lost her. This story is not unique. So many people like yourself have experiences of having sent money for your grandparents, for your parents, hoping that they will receive care, be taken care of, have someone care for them in a way that would have ended up in them being here with us. But so many people have these stories ending up in tears and in loss. This is why Flurry was started. I really want to make sure that for those of us who no longer live close to the people that we care about, it doesn't spell the end of the support and responsibility that we feel towards them. Flurry is here for you. Flurry is here for your loved ones. Give us an opportunity to show you what care could really mean. Thank you.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back and thank you for everyone who has joined us. And for those of us who have just joined us, I'd like to say a big welcome to you. Today we are going to be discussing breast cancer awareness. We will be joined by Dr. Jamila Oko. She's backstage getting ready. But before she comes on, we'd like to just recap what we spoke about last week, which is the community Ghanaian clinic that's going to be opening. For those of us who've been in the Chicagoland area for a while, we know that Ghana National Council had an initiative, and the initiative was to make sure that everybody's health and wellness was taken care of. This is something that Ghana National Council has been doing twice a year at various churches. However, as we joined together with Ghana House Incorporated, we wanted to have a community health clinic. The health clinic is going to be on the second Saturday of every month, and we are going to be assessing people for hypertension, diabetes, high cholesterol. We'll be able to write prescriptions, and that way we can be your primary care provider, and you can come and see us every month so we can be able to follow up with your care. This is going to be very good for the community. Eventually, our plans is to turn this into a clinic that's more recognized and will accept different insurances. But for now, the services there will be free. If you are on any medication and you are worried about how you're going to get your prescription, Dr. Ofori will be joining us later to give us our COVID update. And he is also the head pharmacist that will be at the clinic. There are a variety of ways that you can get your medication, and many medications that treat certain conditions, including hypertension and diabetes, are on the $4 health plan. So at this time, I'd like to turn this over to my producer so we can hear a video from our medical director, Dr. Prince Hodebe, who is going to explain to us all about the mission for the Ghanaian Health Clinic.
Fellow Ghanaians in the Chicago area. My name is Dr. Prince Hodogbe. I am a family practice physician and have been practicing in the Chicago area for some time now, for a very long time actually. The Ghana National Council and the Ghana House Incorporated are coming together to continue the health and wellness expo that has been going on in the community before COVID came in. We plan to screen for common diseases like diabetes, high blood pressure, high cholesterol, some skin diseases, and many of the women's health problems. Our first event is planned to be on November 13th, 2021. We also plan to educate the community on the vaccinations, especially the COVID vaccines, and also the influenza vaccines. And if possible, we are planning to have some supplies of the COVID and the flu vaccines and give them to people who have not yet received their vaccinations, especially the COVID vaccines at that time. We encourage the community to come in their numbers and participate in this event. As I said, if we have more people participating, we may increase our once a month event to maybe twice a month, but that depends on the number of people who come in to the first event and people who are interested in the events going forward. The first event will be held at the Methodist Church on North Killer Avenue. The exact address is 4047 North Killer Avenue, Chicago. And we plan to see as many people as we can see on that day. The event starts from 11 o'clock and runs through 3 p.m., 11 a.m. to 3 p.m. We want to see many people in that event, and from that point on, the second Saturday of every month, we will be holding this event from Ghana National Council in conjunction with Ghana House Incorporated.
Yaba, maka maka. Entertainment and sports, maka maka. As a politics, maka maka. Royal Black says, Assembly Safwa, Bia Assembly Puno, Sanepi Adekami, Ekome Yakotokumi, Ekome Yami Sebe, you want love fake hanging, maka maka. Royal Black says, Yaba, maka maka. All the trending issues, maka maka. As a politics, maka maka. Entertainment and sports, maka maka. RBJ Diaba, where you full from crowd. Asami Safwa, yeah, Asami Puno. Sasemino ba, yeah, Beka. Senya Betino, Sabape na Yebekano. Maka maka, akesame kwedewo. Wabayuye no ni wona je no na ke. Wabayuye no ni wona je no na ke. Say your politics RBJ Beka, or Beka, sports RBJ Beka, or Beka, entertainment to RBJ Becca, or Becca, trending issues. RBJ Becca, or Becca. Maka, yeah, diabao, yeah, Becca. Maka, yeah, diabao, yeah, Becca. Chocolate is the first luxury. It has so many things wrapped up in it. Deliciousness at the moment, childhood memories, and that grind-inducing feeling of getting a reward. Now think about it. Chocolate presented as things you love the most. Yes, and edible too. Try our chocolate shoes and your love for chocolate will go a notch higher. You will never see chocolate just as a bar. Your imagination will go wild. Go ahead, take a bite. Kabi.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining us, and for those of us who have just joined us, I'd like to say a big welcome and a good evening to you as we enjoy Health Talks. We've been talking a little bit about the Community Health Ghanaian Clinic. This clinic's main need is to make sure that everybody in our community has access to quality evidence-based healthcare. As we just heard from our medical director, Dr. Prince Hodabe, there's going to be a lot of assistance there in terms of internal medicine, family practice. There's going to be women's health. We're going to try to get enough of the COVID-19 vaccines and influenza vaccines. So I'd like to just make sure that everyone is aware of this service. If you have any questions or you want to give your comments here on the program tonight, you can send us a message via WhatsApp only at 773-312-0318. Health Talks is brought to us proudly by Ghana National Council and Trend Africa TV. And our sponsors are the Jemima Nunu Foundation, Omama TV, Holiday Africa, and PA Ventures. For you to know about all the announcements that are going on in the community, please make sure that you tune into Omama TV on Thursday mornings, because he gives a whole synopsis of everything that's going to be going on in the Chicagoland area in case you miss anything. So this is what we are going to be doing. If you have any questions about the clinic, if you want to maybe call ahead of time to see if we'd be able to take care of your health need, you are more than welcome to do that. The numbers were on the video. You can reach out to either Dr. Hodabe, Dr. Jamila, Dr. Habiba, or myself, including Dr. Ofori. We are all here to help you, and we hope that everybody in the community will take full advantage of this wonderful opportunity. We're going to take a quick break, and when we come back, we're going to be joined by Dr. Jamila, and she's going to be talking to us about breast cancer. So stay tuned, and we'll be right back. I'm Dr. Araba, and this is Health Talks.
Welcome to sankofaonline.com. Your #1 diaspora news portal has joined with GhanaWeb.com to bring to you the latest news around the world, especially Ghana. Visit our website at www.sankofaonline.com, or you can download our app from the Google Play Store or App Store. Sankofa Online, serving the Ghanaian Chicago community.
Internet is so much fun, I know. Corona is trending fast, I know. Some are scary, some are funny, others too fake news. Then don't share. Why not go to the right place for Corona news? Spreading lies can hurt. Share the facts, not those memes. You might save a life. Save a life? Yes, save a life. You can play your part. Children like us can also play their part by sharing only the facts? Yes, spread only the facts. Play your part too.
Be the one to spread only the facts from the Ghana Health Service. Play your part. In case of any emergency on COVID-19, call 112 or 311. This is brought to you by the Ministry of Health, Ghana Health Service, and UKAID.
Looking for that special gift for that special someone? Looking to bring life into your personal or family portraits? Art Bank is your creative bank of art solutions. We provide a wide range of digital photo editing and paintings that will transform your images into exquisite yet affordable pieces of art. We bring old photos back to life. Your photos can be framed or made into canvas prints of any size of your choice. Our ultimate goal is to bring into your homes and offices amazing masterpieces through eye-catching portrait paintings for occasions such as birthdays, graduations, award ceremonies, funerals, and many more. You can locate us on Instagram at @bankgh. You can also contact us on 312-609-9907 or @bankgh@gmail.com for all your inquiries. Art Bank, reviving your images.
Is there a place for the hopeless sinner who has hurt all mankind just to save his own? Believe it.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for staying tuned with Health Talks on Trend Africa TV that is brought to us proudly by Trend Africa TV in partnership with Ghana National Council. And our sponsors are the Jemima Nunu Foundation, Omama TV, Holiday Africa, and PA Ventures. According to the World Health Organization, breast cancer is the most common cancer among women worldwide, claiming the lives of hundreds and even thousands of women each year and affecting countries at all levels of modernization. According to the American Cancer Society, when breast cancer is detected early and is in the localized stage, the 5-year relative survival rate is 99%. Early detection includes doing monthly breast exams and scheduling regular clinic breast exams and your mammograms. Very, very important information. And we know that October has been set aside for breast cancer awareness. That is why we are bringing forth to you an experienced obstetrician and gynecologist, Dr. Jamila, who is going to be breaking down breast cancer for us so we can be able to understand it a little bit better. As we are waiting for her to get prepared backstage, I'd like for us to watch 2 short videos about breast cancer. Stay tuned.
Enuanom na adofo me chiachia obi biara. From Royal Helmina and Nanu. Messiafo won dwumedi bia wodin watakrade afi biara mu na. A wo friend takrade ladies conference na amena medan. Obesa busumi ye bosoma yezi bodewu kokram yarebe mu. Meresre obi biara benyino obesi o ko hospital another clinic. Ko na ko hwehwe wanufum ne yenhwese bibi wo ma yetumi ya aboa ya aso ano. Bibere anyim nso a na wa cheche o mesmebe ya ebotuma abo ho ban kokram yarebe mu. Ke hu de ye hu ntama ya so ano a oyi meda wana asi bebre.
Hello everyone, I'm Empress Mousy.
I'm SB Don, the Rare King. And I'm Toki Hododio, the First.
And we are the Hododio team. As we all know, October is Breast Cancer Awareness Month.
And we are here to celebrate and honor the survivorship and remember our loved ones that we've lost to breast cancer.
Breast cancer is the most common cancer in women.
Yes, regular breast checkups is the best way to detect breast cancer early. Early detection provides you with a vast variety of treatment options.
Men, I encourage you to support your women. Encourage them to get regular mammograms.
Whether you are funding mammograms, supporting education, or helping women in the community, just press on this link and donate to help women suffering with breast cancer or to help with the payment of the screening tests. Hold your name lo.
Aho.
Hold your name.
Aho. Bye bye.
It's Hot Ice exclusive on the beat.
Demi strings on the beat.
I hear, say, I care, obey. Siren Pesroe, clonuti bale, gato baby, akuvie, mecho, abo, echo, wiki, mile collabo, mecho, abo, echo, wiki, mile collabo.
Indreke mi anodo, mi tocarane mi anoni he. Everything you do, people go say. So you got to live your life, live to please the world. I hear, say, I care. Go back, lele.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome.
Thank you once again for tuning in. We are still waiting for Dr. Jamila Oko. She's going to be joining us very shortly. So in the meantime, what I'd like to make sure that everyone understands is about Fleary. Fleary is a health insurance remittance company. They allow people in the diaspora to pay monthly installments for health insurance for their loved ones back home. Stay tuned and let us hear a message directly from the CEO, Mr. Sam Badu.
Thank you so much for choosing to trust us and for your interest in learning more about Fleary. You might probably be wondering, Why has this never existed before? Why have other people not attempted it? That answer could be a lot of different things. But it's important for me to share with you why Flurry is my passion and why I would go to the ends of the world to make sure that your loved ones are protected. 2 years ago, I lost my grandmother in the most unfortunate situation. She needed care in Ghana, but never had the infrastructure, even though we sent money to her, to be able to make the right choices and access the care she needed and deserved. I don't want that to happen to you. A year ago, I went through a very traumatic experience. My mother had fallen sick on her birthday. She had a mini heart attack. She was taken to the hospital, but like every other African mother, did not want me to worry. For 2 days, I had no idea that she was fighting for her life. If not for a friend who happened to be a doctor taking interest in her at the hospital she was taken to in Ghana, we probably would have lost her. This story is not unique. So many people like yourself have experiences of having sent money for your grandparents, for your parents, hoping that they will receive care, be taken care of, have someone care for them in a way that would have ended up in them being here with us. But so many people have these stories ending up in tears and in loss. This is why Flurry was started. I really want to make sure that for those of us who no longer live close to the people that we care about, it doesn't spell the end of the support and responsibility that we feel towards them. Flurry is here for you. Flurry is here for your loved ones. Give us an opportunity to show you what care could really mean. Thank you.
Hello everyone, I'm Empress Mousy.
I'm SB Don, the Rare King.
And I'm Toki Hododio the First.
And we are the
Hododio
team. As we all know, October is Breast Cancer Awareness Month.
And we are here to celebrate and honor the survivorship and remember our loved ones that we've lost to breast cancer.
Breast cancer is the most common cancer in women.
Yes, regular breast checkups is the best way to detect breast cancer early. Early detection provides you with a vast variety of treatment options.
Men, I encourage you to support your women. Encourage them to get regular mammograms.
Whether you are funding mammograms, supporting education, or helping women in the community, just press on this link and donate to help women suffering with breast cancer, or to help with the payment of the screening tests. Follow your namilo.
Aho.
Follow your nami.
Aho.
Enuanom na adofo me chiachia obi biara. From Royal Helmina and Nunu. Messiafo won dwumedi bia wodin watakrade afi biara mu no. A wo friend takrade ladies conference na amena madan. Obesa busumi yebosoma yezi bodewu wo kokram yarebe mu. Meresre obi biara benyino obesi o ko hospital another clinic. Ko na ko hwehwe wenufum ne yenhwese bibi wo ma yetumi ya aboa ya aso ano. Bibere anyim nso a ne wa cheche o mesmebe ya ebotuma abo ho ban wo kokram yarebe mu. Ka ehu de yehu ne ntama yeso ano a oyi meda wana asi bebre.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Logging on as we speak, so I'll go ahead and introduce her. Dr. Jamila is a second-generation Ghanaian that was born and raised in Chicago. She received her Bachelor's of Science in Nursing degree from the University of Illinois in Chicago. She worked as a pediatric nurse for 5 years before pursuing a career in medicine. Dr. Jamila graduated from Rush Medical College and with her doctorate in medicine. She completed her residency training in obstetrics and gynecology from the University of Chicago. Dr. Jamila's special interests include menstrual irregularities, contraception management, and postmenopausal bleeding. Dr. Oko's pastime outside of work include volunteering at the Community Health and Wellness Expo, spending time with her family, gardening, and skiing. Let's see if she's ready to come on. Dr. Jamila, are you with us? You know, it's always very difficult and very humbling whenever you invite a lot of physicians to come on the program. Sometimes they are, they're stuck with patients, or sometimes they have technical difficulties. So let us be patient and wait to hear from Dr. Jamila. She's going to be teaching us tonight all about breast cancer. As we've seen from the two videos that we watched, Breast Cancer Awareness Month is in October, and Health Talks with Trend Africa TV and Ghana National Council want to make sure that everybody is doing their mammogram. Currently, right now with Uber, you can set up an appointment for free and they will take you to go and get your mammogram. So make sure that you are getting your mammogram, make sure that you are doing everything to keep your breasts healthy. And Dr. Jamila is with us. So Dr. Jamila, good evening. How are you?
Good evening. How are you?
I'm fine. Thank you. Thank you so much for joining us. We know that you are very busy, so we are honored and we are privileged to have you here this evening.
Well, thank you for having me.
You're welcome. So I always like for our viewers to get to know who we are interviewing. So this is Dr. Jamila. So go ahead and tell us what made you decide to do medicine. We know you started off with nursing, and then after 5 years, you went to do your medicine degree. So what made you decide to do medicine?
Well, I think I've always wanted to be a physician. Growing up, actually, I wanted to be a pediatrician. But when I applied to college, I had a lot of hesitancy. And so I had an aunt that was a registered nurse. And so she was the one that encouraged me to start off with nursing first, so that I kind of get an idea of what the health field had to offer. And once I became a nurse, actually a pediatric nurse to be, to be more specific, I worked for 5 years, and that actually was a really good foundation. And then that actually is what propelled me to pursue medicine as a career at this point.
Marvelous. So for all of our nurses that are watching and who intend to go back to become doctors, Dr. Jamila is a perfect example that you can start from somewhere and just work your way up and get to what your ultimate goal is. And I think that's very important for us to all know. So what had you choose women's health in specific?
I think I chose women's health because I knew how important it was for pediatric health, right? So not only, if you address like women issues, you do find that, a lot of times pediatric issues improves as well. And then I just kind of like the nature of women's health, or maybe obstetrics and gynecology to be more particular, because it offered a wide range of things. You deal with, with obstetrical issues, you deal with preconception, you deal with menopausal issues. So you kind of see women from adolescence all the way until like their postmenopausal years. And so you have the opportunity to do medical management. And also I do surgery as well. So, I just felt like it made me a more well-rounded physician, where I can offer all types of services to women across the lifespan.
Absolutely. So we're going to jump right in and just talk about your career as a women health specialist, which is a gynecologist. So in general, how often should women go and see their gynecologist?
Okay, so we actually recommend that women, or young women, probably starting around the age of when they start their first period or menarche, to actually touch base with a gynecologist, because there's several issues that arises throughout that time period, and even following childbearing years and postmenopausal period, that there's issues that come along in a woman reproductive tract. So we actually encourage girls because a lot of people just think like, oh, only once you get pregnant is when you should see an obstetrician or gynecologist. But, there is like a lot of reasons why you should touch base even before then. So we actually encourage, like, once girls start menstruating, so average age is around 12, to make contact. Because we help to identify any menstrual issues that can come along, such as heavy menstrual periods, painful periods, sexual health, contraception management, HPV, HPV and cervical cancer screening, breast cancer screening. It runs the gamut. So you kind of address those issues. And I mean, although yes, women's health cross path with like family medicine, internal medicine. When you do see like a gynecologist or obstetrician, this is pretty much our specialty. So we can dive into some of more particular issues that affect women and have far more management options and treatment options that can be offered when you see a specialist in these areas.
Absolutely. In terms of, I mean, not only seeing your family practice medicine, you're saying that when people start their period, they should also be encouraged to see their gynecologist to take care of all their female needs as well.
Exactly. And we do encourage that women start, young women start as early as 12 up until like, postmenopausal 80, 90. They can see a gynecologist like once a year. Okay. Now there's certain things that we don't do on a yearly basis. But in general, what we do on, when you come touch base on an annual basis to find out about like your menstrual cycles, how are they throughout the year, and we can intervene much earlier than if you wait until the problem happens. So a lot of women, especially in the childbearing years, they tend to have anemia. They tend to be anemic, right? And the primary source of that anemia are their menstrual issues. So, if you talk to a provider on a yearly basis, a lot of times we run a complete blood count, see what your hemoglobin or your iron levels are. So if we find that those levels are declining past a certain point, actually address them with some of the management, mainly hormonal contraception, right? Or like even with pain management. So we do encourage that women to come in on a yearly basis to be seen, but some things we don't do on a yearly basis, like cervical cancer screening. And this actually changed nearly 10 years ago when they made the major changes to the guidelines, because once upon a time we were screening for cervical cancer on an annual basis, and then eventually it moved to like a twice every 2 years, and now it's currently every 3 to 5 years. And there's a lot of data that supported that move to actually extend the surveillance period. Now, obviously, if you're having like abnormalities in any aspects, the timing of cervical cancer screening will change, but it just depends on what's going on. But once again, if you come to us on an annual basis, if you're starting to have issues, we can identify it much early. So it's just more, when you see us on an annual basis, more as a wellness check, more so than for a problem visit.
Okay. And that will give you a better idea of how to take care of people further if you're coming from a yearly visit.
Yes.
Okay. And you mentioned that you do collaborate with the primary care physician. So in general, or to you, why is preventative medicine so important, especially when it comes to women's health?
Oh, when it comes to women's health, because once again, you can identify issues on an early onset rather than waiting to later in the process. So once you address it at a much earlier stage, it's less likely for that issue to become more disruptive in that patient's life. So, prevention is key. And I think with healthcare in general right now, there's this strong push to do primary, preventive medicine versus tertiary medicine, where you wait for the issue to spiral out of control. One is more cost effective. Two is, the benefits of identifying issues early on, or even to prevent them from happening long term, would extend your lifespan. So it has many more benefits to do it, annually versus waiting until you have a problem to touch base with any type of provider to address any of these issues.
Very good. And you mentioned a little bit about the screening that goes on when they do come there, but could you tell us in general what is recommended for females in terms of screening and how often?
Okay, so we actually break up our screening process into like different age groups. So from, let's say from 12 or from the ages of 15, actually, let's start from 15. So from 15 to 25, our primary goal is STD screening, because we know at that point in time, that's when most girls make their sexual debut. So you want to touch base about, do STD screening, talk to them about being safe with some of their sexual practices, and also to offer contraception if they're not quite ready to start having children. Okay, so when we see girls in that age group, the big push once for the most part is, STD screening, educational sexual health, contraception management, and also that's when we start, HPV vaccination, right? So, a lot of times they start HPV vaccination in a more so in a middle age group. So starting from like maybe age 10 or 12. And the reason why they started at that age group is so that, they know that in that age group demographic, girls have not made their sexual debut. Right. So the HPV vaccine is actually most effective before girls make their sexual debut. So by the time you get to 15, you're just trying to make sure that they have had their HPV vaccine. And if they haven't, then you can actually catch them up and actually provide them with those vaccine series. Then from, like I said, from 15 to 25, those are the things we focus on. Now, once girls reach the age of 21 is actually when we actually start doing cervical cancer screening, where we're doing the pap smear. Okay, so we do that age 21, and we actually do it from age 21 to 65. Okay, so from age 21 to 65, we do the pap smear every 3 to 5 years if there's no issues at all. Now, if there's issues, then we change how often we do the screening and all, and also, so as a result, it'll be much more frequent. Now, moving along from 15 to 25 or 21 age group. So now you from 21 to like, let's say 50, right? Or to, let's say 21 to like 39, our primary focus is to do like HPV screening, right? We talk a lot about weight management and healthy dietary practices, because believe it or not, weight, right, and your diet does play a huge role in your menstrual cycles. Okay, so we try to kind of reinforce like healthy weights and ideal weights and things like that. Once you get from age 40, once you hit age 40, then our focus at that point is actual breast cancer screening. Okay, so breast cancer screening actually is supposed to happen from age 40 up until age 75, believe it or not. Okay, and you're supposed to do breast cancer screening every single year. Now, obviously, if you find out that they have like family history of breast cancer, right? The next question you ask is how old that person was when they did develop breast cancer, because if you find that they had a mother or a sister, so a first degree relative, so an immediate family member that had breast cancer, that would actually impact how soon you do the breast cancer screening. So like, let's say you had a standard breast cancer screening, if you remember me saying starts at age 40. But like, let's say if you had a mother that had breast cancer at the age of 45, the recommendations are you're to start breast cancer screening 10 years before that person in your family developed breast cancer. And the main reason you do it 10 years before is so that you can get a baseline as to what the breast looks like. And so then if something does come about, you have something to compare it to. Also, this is in addition to that, we offer genetic screening to see if possibly your breast cancer that your family member had, if it's genetically linked. Okay, so if it's not genetically linked, then we just do the screening test, right? But if it is genetically linked, then there's other things that you may need to do, right? And other things that you may have to focus on. Because a lot of times when you do have breast cancer that's genetically linked, which was BRCA1 and BRCA2, they're at risk for other forms of cancer, such as ovarian cancer. Okay, so then if you're at that risk for ovarian cancer, a lot of times you have to perform a procedure where you remove those ovaries once they're done with being childbearing years. Okay, so So with that being said, breast cancer screening is from 40 to 75. Now, obviously, if you have women are living much longer now, right? So, even though the general recommendation is to do it between ages of 40 and 75, if the female is still, still living at 75, we do continue to do breast cancer screening past
Oh, you
that
do?
point.
Okay.
Yeah,
Okay.
we do. We do.
Okay.
And so, because once again, if they come from a long line of females that live to be 90, because the thing is this, breast cancer is the is the highest form of cancer in females, right? So, so to give you an idea, the number of cases per year that is diagnosed is like at least 200,000, right, per year in the United States. That's the highest, right? So even like with cervical cancer screening that we do on a yearly, like every 3-year basis, the cervical cancer is not really, it's not a common cancer, especially in this country. You get like only 12,000 cases a year.
I see.
Yeah.
So, Dr. Oko, are you saying so when people are older than 75, you're going to be screening them for breast cancer? Does that mean that they need to still be going for their yearly mammograms, or will they be coming in more for like their well woman and then like the breast exam?
Yeah, I mean, we still do a well woman exam. And people like, well, why do you need to come to a gynecologist once you're done having your periods, right? And the thing is this, there's other issues that come up in the female genitalia tract, right? So you have, and this is the thing that's not really talked about a lot in the media, where, with postmenopausal women, they start to develop like changes in their vaginal tract or their genital tract, right? Where they get more itchiness, or they may get more pain or dryness, right? And the main reason for that is because they no longer have an estrogen source, right? And so sometimes with with those symptoms, it becomes distressing. Other issue you may have is urinary issues, right? Where sometimes people have problems holding their bladder, and it interferes with their life. So they may have problems like holding their bladder, or they actually go to the bathroom very frequently in the middle of the night. So you have some women that wake up 2-3 times in the nighttime to go to the restroom. And so as a result, when they wake up in the morning, they're very groggy, very fatigued, lethargic, which then leads to some moodiness, right? And so a lot of times people like, well, why am I having these issues? And it's because you're waking up in the middle of the night. So a lot of times when you come and you tell us these things, at least we can address it and try to fix it so that your quality of life is, it's not impacted, So, it's like, it's a way for us to kind of touch base and to just kind of, once again, follow up on smaller issues that can just be addressed rather than wait till it becomes more of an issue.
Wonderful. And that was a very good detailed information about the mammogram. So for people who do not know what mammograms are, Dr. Oko, can you just tell us what exactly is a mammogram? What does it entail?
Okay, so so the mammogram is actually it's an imaging study, right? That uses a form of X-ray energy, and what they do is they put the breast in between these two plates, and then they take different viewpoints of the breast, right, to see, and then they kind of recreate the image of the breast to see if there's any type of masses or any type of abnormalities that may suggest that you potentially have breast cancer. So, I know in conjunction to doing mammograms, we talk about doing self-breast examinations. But quite frankly, doing mammograms actually catches microscopic disease that you won't be able to feel with your hands, right? So it catches the disease process, as it's starting to develop. So then when you catch it at its very early stage, you're able to use less aggressive management to actually deal with it. Okay. So of course there's other imaging modalities that look at breast. There's MRI, which look at like MRI is look at it's a different form of imaging that kind of also recreates the breast tissue to kind of identify any lumps and any kind of diseases as well. A lot of times they reserve MRIs for people that have a certain breast quality. So you'll probably hear something like, oh, my breasts are very dense, or I have fuller breasts. So they may use an MRI in conjunction to the x-ray or the mammogram to actually get a better idea of what's going on. Because sometimes when you do have denser breasts, you may not, you can easily misdiagnose like normal breast tissue for something that's actually an actual mass and that is potentially cancerous. And then also the last imaging modality we use is something called breast ultrasound, right? And that too is used in women that may have denser breasts or bigger breasts. And so once again, it kind of looks more closely at like the ducts or like the passageways, and also once again these masses to see if there's anything that's there. So, but the first step is the screening mammogram, and then they use these other modalities if they need to. Okay.
Let's talk a little bit about the self-breast exams, because we hear that a lot of people are pushing for those. Exactly when should that be done, and how should ladies be doing that?
Okay, so I remember years ago, they had all these different, they had a lot of education and teaching on how to do the thing, how to perform appropriate breast exam. So they would say, oh, you want to do it in a circular pattern or go back and forth, and you want to do it in the shower, maybe on the first day of your period, just for consistency. The thing is, for the past several years now, we're trying to move away from the language of saying self-breast examination to calling it breast awareness. The main reason why they've changed the wording is because they find when you say self-breast examination, it can be very intimidating to some women and anxiety provoking. So if you just tell women, you know what, just check your breasts. We don't care how you do it, how often you do it, as long as you do it consistently, right? So if you want to do it every day, once a month, once a week, it's fine. But just feel your breast. And the main reason so that you know how your breast texture feels. So if you know what normal feels like, if something does come up because you check it on a more regular basis, right? Then you'll be able to say, hey, I didn't feel this last week or last month. So the real reason, so right now, all we encouraging is for people just to do self-breast awareness, feel your breast. And if you don't want to feel your breast, you can have someone else feel your breast, like your significant other, because they definitely know how your breast feels. But the whole thing is just make sure you do it regularly, and just so you know what normal feels like to you.
That's really important, because I think that you're right. It is quite intimidating. And I know before they used to have those shower cards that they were passing out when you go to, and it's like, you wonder if you're doing it right or wrong. So for everyone that's watching, Dr. Oko is telling us that we should just check them frequently, and that way we can be able to let our physicians know if you feel anything different. And I think that one thing is very important is that if you do happen to feel something different, you do need to we should kind of remove the anxiety and let the physicians make sure that they're taking care of it. And of course, early detection is key. And that is what we are learning this evening. We're going to take a quick break. When we come back, we're going to talk a little bit about COVID-19 within pregnancy and hear more about breast cancer. I'm Dr. Araba, and we are joined by Dr. Oko, and we'll be right back. Stay tuned.
Fellow Ghanaians in the Chicago area. My name is Dr. Prince Hodogbe. I am a family practice physician and have been practicing in the Chicago area for some time now, for a very long time actually. The Ghana National Council and the Ghana House Incorporated are coming together to continue the health and wellness expo that has been going on in the community before COVID came in. We plan to screen for common diseases like diabetes, high blood pressure, high cholesterol, some skin diseases, and many of the women's health problems. Our first event is planned to be on November 13th, 2021. We also plan to educate the community on the vaccinations, especially the COVID vaccines, and also the influenza vaccines. And if possible, we are planning to have some supplies of the COVID and the flu vaccines and give them to people who have not yet received their vaccinations, especially the COVID vaccines at that time. We encourage the community to come in their numbers and participate in this event. As I said, if we have more people participating, we may increase our once a month event to maybe twice a month, but that depends on the number of people who come in to the first event and people who are interested in the events going forward. The first event will be held at the Methodist Church on North Killer Avenue. The exact address is 4047 North Killer Avenue, Chicago. And we plan to see as many people as we can see on that day. The event starts from 11 o'clock and runs through 3 p.m., 11 a.m. to 3 p.m. We want to see many people in that event, and from that point on, the second Saturday of every month, we will be holding this event from Ghana National Council in conjunction with Ghana House Incorporated.
Hello everyone, I'm Empress Mousy.
I'm SB Don, the Rare King.
And I'm Toby Holodio the First.
And we are the Holodio team.
team.
As we all know, October is Breast Cancer Awareness Month.
And we are here to celebrate and honor the survivorship and remember our loved ones that we've lost to breast cancer.
Breast cancer is the most common cancer in women.
Yes, regular breast checkups is the best way to detect breast cancer early. Early detection provides you with a vast variety of treatment options.
Men, I encourage you to support your women. Encourage them to get regular mammograms.
Whether you are funding mammograms, supporting education, or helping women in the community, just press on this link and donate to help women suffering with breast cancer, or to help with the payment of the screening tests. Holodio namilo.
Aho.
Holodio nami.
Aho.
Enuanom na adofo mi chiechia obi biara. From Royal Helmina and Nanu. Messiafo won dwumedi bia wodin watakrade afi biara mu no. A wo friend takrade ladies conference na amena madan. Obesa busumi yebosoma yezi bodewu wo kokram yarebem. Meresre obi biara benyino obesi o ko hospital another clinic. Ko na ko hwehwe wanufum ne yenhwese bibi wo ma yetumi ya aboa ya aso ano. Bibere enyim nso a na wa cheche o mesme be ya ebotum abo ho ban wo kokram yarebem. Ka ehu de yehu ne ntama yeso ano a oyi meda wona asi bebre.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining Health Talks. I'm Dr. Araba, and we've been speaking with Dr. Jamila all about breast cancer. As we are talking about breast cancer, we can't also miss about COVID-19 and pregnancy. And since we have a specialist here, we'd like to ask a few questions that came in through our panel. So, Dr. Jamila, first thing we want to know is the COVID-19 symptoms also similar during pregnancy, or are there specific symptoms that pregnant people have through COVID-19?
So with COVID-19, I would say close to 75% of women who do get COVID tend to have very mild symptoms, right? But the problem is we don't know which ones of those women will have milder symptoms versus severe symptoms as COVID in the general population. Secondly, we all know that when you are pregnant, your immune system is considered weaker than when you're not pregnant. Okay. So even though I just mentioned that COVID-19, if you do get it, is a milder infection, the problem is when you do have a weaker immune system, being pregnant,
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
We're sorry about that. Looks like we had a little bit of a communication issue. So we're going to go ahead and let Dr. Jamila finish telling us about COVID-19 and pregnancy. I think we might just have a little bit of a connection issue. So let's just give her a little bit of time. Maybe she'll refresh her screen. In the meantime, we'll see if Dr. Ofori is with us to give the COVID-19 update. I think he's getting ready backstage. So let's see if we can just wait a little bit and we'll reconnect Dr. Jamila. In the meantime, let's go ahead and take the video again from Fleary. Fleary, once again, is an insurance remittance company that allows us here in the diaspora to pay for our family members back home to have health insurance. That includes medical consultations, pharmacy care, dental care, and even ambulance care. So very, very important. If you've not yet registered your loved one for Fleary, today is a great opportunity to. So let's listen to a message from the CEO, Mr. Sam Badu.
Thank you so much for choosing to trust us and for your interest in learning more about Fleary. You might probably be wondering, why has this never existed before? Why have other people not attempted it? That answer could be a lot of different things. But it's important for me to share with you why Fleary is my passion and why I would go to the ends of the world to make sure that your loved ones are protected. 2 years ago, I lost my grandmother in the most unfortunate situation. She needed care in Ghana, but never had the infrastructure, even though we sent money to her, to be able to make the right choices and access the care she needed and deserved. I don't want that to happen to you. A year ago, I went through a very traumatic experience. My mother had fallen sick on her birthday. She had a mini heart attack. She was taken to the hospital, but like every other African mother, did not want me to worry. For 2 days, I had no idea that she was fighting for her life. If not for a friend who happened to be a doctor taking interest in her at the hospital she was taken to in Ghana, we probably would have lost her. This story is not unique. So many people like yourself have experiences of having sent money for your grandparents, for your parents, hoping that they will receive care, be taken care of, have someone care for them in a way that would have ended up in them being here with us. But so many people have these stories ending up in tears and in loss. This is why Fleary was started. I really want to make sure that for those of us who no longer live close to the people that we care about, it doesn't spell the end of the support and responsibility that we feel towards them. Fleary is here for you. Flurry is here for your loved ones. Give us an opportunity to show you what care could really mean. Thank you.
Thank you once again for staying tuned. We had a slight connection issue, but Dr. Oko is back. So go ahead and continue.
Yeah, I apologize for that. I'm having connection issues because of the rain.
Oh.
As I was mentioning earlier about the COVID vaccine in pregnancy, we do highly encourage it because once again, you don't really know if you will have mildest
Once again, I apologize. It has been raining very heavily for the last couple of days, so connection is an issue. Dr. Jamila is here with us, so she'll go ahead and continue.
Yeah. So COVID, unlike some illnesses like that, say Zika or chicken pox or rubella, which is German measles, those viruses have an actual direct disease link with the fetus and does cause serious congenital anomalies or serious birth defects among babies. But unlike those, COVID does not cause any indirect issues to the fetus. The more the issues are indirect. So if mom happens to get COVID and she becomes severely ill, because it is a respiratory issue, and when you're pregnant, you already have you have significant changes to your respiratory system. What can happen is the mom has a lot of shortness of breath, right, and oxygenation issues. So because of those oxygenation issues, which is the amount of oxygen that's being transferred from the mom and baby, what happened is it can lead to the infant having restriction in their growth, right, in terms of how big the baby can be. It can lead to preterm labor. It can lead to just heart, like the baby having drops in a heart rate. So it's more, like I say, it's more of an indirect issue to the fetus. And so, but with that being said, you do not want to deliver a baby that's preterm, because we know with preterm infants, especially depending on how early those infants are developed, they can have long-standing issues throughout their life. So if you happen to have a baby that's born at 25 weeks, they may have significant respiratory or neurological issues that can lead to cerebral palsy, that can lead to like respiratory distress and things of that nature. So you really don't want to, deliver a baby at that early age. So if you can prevent that from happening in the first place, our biggest treatment option that we have is to get vaccinated. And so the thing is, once you get vaccinated, not only is the mom protecting herself, she's also protecting the child as well, because once the mom get the vaccine, she passes on a lot of the properties or or proteins that help fight off infection. She passes it on to her baby. And so the baby gets those vaccines inside in utero and also gets it once the baby is being breastfed. So it's like almost a 2-for-1 deal. So there's really no, there haven't been found, so as of right now, there haven't been any issues associated with the COVID vaccine that's being given during pregnancy. Even prior to pregnancy, there was rumors like, oh, it can cause infertility. It can cause blood clots. And so to kind of to debunk those myths, it does not cause fertility. Trust me, it has not caused fertility. If anything, we've seen quite a bit of patients being pregnant during this COVID era, and these moms have been vaccinated. The other thing is, like with the Johnson & Johnson vaccine, there was like this very rare blood clotting disorder, but it was so rare that, out of so many thousands of millions of people that's been vaccinated, that the risk is like less than 1%. And that was with Johnson and Johnson, but it's still very safe. But then with the Pfizer and Moderna, because they use a different technology to develop those vaccines, that was not one of the risks that was reported with those two vaccines.
So for your pregnant people, are you recommending Pfizer and Moderna versus Johnson and Johnson, or are you saying that all three of them are safe? Take whichever one's available.
I'm saying all three are safe, and you could take which one is available.
Wonderful. And you mentioned a little bit about breastfeeding, and that was a question that we came across on our platform. It said, should I breastfeed if I'm infected? So if someone who currently has COVID-19 is breastfeeding, should she continue breastfeeding, or is this a time that she needs to like waste her milk and then wait?
No, she can actually still continue to breastfeed.
Okay.
Now, in the early parts, when COVID was first detected, we didn't know what the issues would be. So we were recommending pumping and dumping, but that we have since moved far away from that, like after maybe 2-3 months into the pandemic. So as of right now, it is pretty safe to breastfeed, and you do not have to pump and then discard that milk.
Okay, so it's safe to breastfeed whether you are COVID positive or not. Okay. Another question we had is, will having COVID-19 affect my delivery and postpartum care?
Oh, so with COVID-19, the thing is this, depending on when you were infected, it would determine like what precautions are being taken when you go into labor. So we do know that once you get the virus, right, it doesn't clear right away for up to 90 days. So, and what we have been doing is that once you go into labor and delivery for whatever reason, like, if you're, had questions about whether or not you're in labor, if your water bag has broken, or if you're having like pain issues, we do test all women that comes onto the labor and delivery unit for COVID. Okay. So the thing is this, if you've had COVID if you have COVID and it's been identified, it's just for the safety of the staff, we probably have to wear more protective gear. Okay, but we won't turn you away if you have COVID. You please continue to come in for care.
Marvelous. And that's very, very important to know. So for everyone who's watching, there's nothing more but just added precautions that will be taken if you are COVID positive, but it's still completely safe to come into your OBGYN office, or any doctor's office for that matter. They haven't been stopping anyone from coming into the doctor's office. So those are our questions about pregnancy. We're going to transition a little bit and talk about the community health clinic. Dr. Jamila is actually one of the medical directors of the Community Health and Wellness Clinic that's going to be coming for the Ghanaian community. So tell us, Dr. Jamila, what has been your experience in the past with the Community Health and Wellness Expo?
So, we've been doing this expo now since like 2017, if I'm not mistaken, correct?
Yeah.
Yeah, so it's been 4 years. Obviously, because of COVID, we moved from an in-person expo or community gathering to more online, more of as an information basis. But I think we've had significant amount of individuals that volunteer, that made donations in terms of medical supplies, monetary funds, and also like food and things like that. And the basis it's mainly a philanthropy. It's a philanthropy venture that we're not requiring any kind of payment to actually attend. Our whole goal is to make the Ghanaian community as healthy as possible, and to make it an environment that's comfortable for them to actually ask questions. Because sometimes we do know, as immigrants, if you walk into an office where you don't feel quite comfortable, you may not ask the appropriate questions or relevant questions that you may want to ask in a non-threatening setting. So it's been an excellent avenue to get answer the Ghanaian community, men, women. We focus mainly on the adults. I don't think we have expanded to serve pediatric patients as of this point, but it's mainly adults. And so we offer like just, it's family practice. There's me as OB-GYN. There's also another OB-GYN that volunteer their time. We have a slew of like nurse practitioners, physician assistants, and physicians that would do a medical history, identify any issues you may have. We do diabetic screening. We do hypertension screening by doing blood pressure check. We even have the capacity to look for diabetes by doing hemoglobin A1C, correct, Eunice?
Yes.
And so, like the whole drive mainly is to just kind of, get people tested to kind of know how their health is at that particular moment. And if we identify any issues, to get them the resources or the contact for that to get addressed.
Absolutely. And since you've been part of it since the very beginning, how have you seen it change? What have you seen that's gotten better within the past couple of years, within the past 4 years, I should say?
Yeah, I mean, it has always been a very well-run program. We try to, we have all of the options that we offer, and as we go to the different, we try to rotate the site at where we hold these fairs. I know a few of them we held in Chicago. I think a few we held one in Romeoville. So I think just depending on where we host the community fairs, and as we get the word out, we're starting to see the participation to increase. But like I say, it's a just to reinforce to people. I know sometimes there's that hesitancy, besides being familiar and coming from a common common country, a common culture, in the one hand that's comforting, but in another hand, some people have their hesitation or reservation because they don't want their health information being public knowledge. And I just want to reassure people that everything that you discuss with us is very confidential. We have an oath that we've taken, and we're doing this purely on a voluntary basis because we know how important health plays in the community as a whole. And the whole point is you want to live for yourself, you want to live for your kids and for your future to come. And so we all have that mission that we just want to improve the health outcomes, and just increase the knowledge base of our community. And that's pretty much our founding mission, for this for us developing this actual community health fair. In the future, we're hoping that we can expand it into actually opening up our own clinic, once again, to serve the Ghanaian community, but also to maybe just serve like whatever community is surrounding by, be it if it's other African countries, be it like Native, indigenous Americans, but to have our own clinic, and which would therefore be another opportunity to have our own community center.
Absolutely. And for people who are watching and they've never had the opportunity of attending any of our health and wellness expos, what would you tell them? What can they expect on November 13th?
What can they expect? What to expect? You have like highly qualified, very knowledgeable health professionals that's there to answer any questions you may have, to review any your health information, and most importantly, it's confidential, right? And our whole goal is to promote a healthier you. So if the main point is just to know, we want you to come, and just be free and just ask any health questions you may have. Besides being uncomfortable asking someone that may not have the same cultural values, another barrier we have been found into healthcare just in general in this country is having insurance. So you have individuals that don't have insurance, or who are uninsured or underinsured, and so they don't have access to see a physician in a timely fashion. So at least if they come to see us at this health fair, and our goal is that we can hope to do it on a monthly basis, so they at least have access to someone on a monthly basis, so we can answer any questions and address any needs they may have.
Absolutely. And there is a telehealth aspect to it, so we can be able to, follow up with people. But I think that what you said is very important, and we will have a number of people there who can speak a variety of languages if they need to explain something in their own language or get instructions. So November 13th is on Saturday. We'll be there from 11 to 3 p.m. at Methodist. For those of us who have just joined, let us take a quick break and hear a message from our medical director, Dr. Prince Hodabe. And when we come back, we'll hear Dr. Oko's closing remarks. Stay tuned.
Fellow Ghanaians in the Chicago area. My name is Dr. Prince Hodogbe. I am a family practice physician and have been practicing in the Chicago area for some time now, for a very long time actually. The Ghana National Council and the Ghana House Incorporated are coming together to continue the health and wellness expo that has been going on in the community before COVID came in. We planned to screen for common diseases like diabetes, high blood pressure, high cholesterol, some skin diseases, and many of the women health problems. Our first event is planned to be on November 13th, 2021. We also plan to educate the community on the vaccinations, especially the COVID vaccines and also the influenza vaccines. And if possible, we are planning to have some supplies of the COVID and the flu vaccines and give them to people who have not yet received their vaccinations, especially the COVID vaccines at that time. We encourage the community to come in their numbers and participate in this event. As I said, if we have more people participating, we may increase our once a month event to maybe twice a month, but that depends on the number of people who come in to the first event and people who are interested in the events going forward. The first event will be held at the Methodist Church on North Killer Avenue. The exact address is 4047 North Killer Avenue, Chicago. And we plan to see as many people as we can see on that day. The event starts from 11 o'clock and runs through 3 p.m., 11 a.m. to 3 p.m. We want to see many people in that event, and from that point on, the second Saturday of every month, we will be holding this event from Ghana National Council in conjunction with Ghana House Incorporated.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you so much for staying tuned today to Health Talks. I'm Dr. Araba. We've been joined this evening by Dr. Jamila Oko, who is a OBGYN. She's given us a lot of information about pregnancy and COVID. She's also given us a lot of information about breast cancer. And she is also one of the medical directors for the upcoming Ghanaian Community Health Clinic. We are very excited, and we know that this is going to be a great benefit for our community. We've been strong doing this for 4 years. We have wonderful volunteers, as she said, and we are excited to serve you. We are excited to meet everybody. One thing I do want to encourage everyone, and Dr. Ofori will be on shortly, is to make sure you bring your medications. Sometimes there's a lot of interactions with medications, so this is a great time, especially if you don't have a primary care provider, for you to bring your medications, and they will do something called a brown bag service to look over everything and make sure that everything is okay. It's 8 o'clock, and we're going to give Dr. Jamila a chance to give her closing remarks, and then we'll hear from Dr. Ofori regarding the COVID-19 updates. Dr. Jamila?
Yeah, so thank you for having me on the show again. I just want to encourage people to attend our community of health wellness event on November 13th. The more people that participate, the more likely we'll increase our frequency and our availability in the community. Not only we want more people to come, we want you to bring a friend, a family member, just to kind of check us out and see what we're about. Like I say, if it's your first time and you may have some hesitation, I mean, you can at least just ask general basic questions. If you need a flu shot, our goal is to have some flu vaccines available. We are in the process of trying to obtain COVID vaccines, but if not, at least you can get your yearly flu vaccine. Just to come and just kind of see what mission we're trying to accomplish, and in hopes of maybe expanding our outreach in terms of health awareness in the community.
Absolutely. And Dr. Okol, what is your closing remarks for people who are listening that really are just maybe nervous about the whole breast cancer? I feel like when it comes to Breast Cancer Awareness Month, we hear so many statistics, and they go really hard and say, a lot of African American women are at risk, and it's just a lot, right? So from a healthcare point, we get it. But what would you tell people watching?
So, a lot of times the thing is this, like when you listen to the news, you have to realize they have sound bites, and they only can get so much information in a short amount of time. So of course they have to find they use language or words that that would grab people attention within that short sound bite. But I want people to kind of do their research, and mainly just talk to your healthcare professional. The issue with breast cancer among African American women is, believe it or not, white women are more at risk for breast cancer. The problem with African American, they have less access to obtaining mammography and to get the breast cancer treatment that they need. So as a result, they tend to die at a higher rate than white women. Okay. So, my whole thing is like, you got to be proactive about getting your mammogram, or just getting your healthcare needs met in general. I know some women have to travel further to like maybe get, to see a doctor or to get your mammogram, but you got to be proactive and get it, and don't be afraid. Okay. Even though the number of breast cancer cases is high, well, relatively high speaking, right? The thing is this, you want to at least if you continue to get screened on a regular basis, if something happened, you're actually catching it at a much earlier stage, rather than just waiting and praying that, oh, God would deliver me, and now you have a huge mass. And instead of just going through one simple procedure to remove the mass, now you're having to do chemotherapy. So, just, approach it like you would do anything else. Like, okay, this is my health. I need to take ownership of it, and don't be afraid. That's my biggest thing.
Absolutely. And thank you so much, Dr. Okol, for your time. We had a couple messages on there. I know the president of Ghana National Council thanks you. He wants to know how you can manage your busy schedule, plus do all of this. He thanks Dr. Hodabe. He said we're all doing a very good job. Mr. Sam, thank you so much for your support. We know that you are 100% behind us with all the things that we are doing with the health and wellness clinic. So we are grateful to everyone who is watching. And because you are very busy, we want to go ahead and give this time to let you go. And once again, thank you very much. And everyone will be looking forward to seeing you on November 13th. So thank you very much.
Thank you. And have a good evening.
You do the same. Thank you.
Okay. Bye-bye.
We are now here with Dr. Ofori, who always sits on our professional panel. Dr. Ofori is an assistant professor of pharmaceutical sciences at the Chicago State University. He is a pharmacist by training. His research focuses on drug discovery and neuropsychiatric disorders, including schizophrenia, depression, and substance abuse. He's going to be giving us our updates this evening on COVID 19. You're more than welcome, Dr. Afoy. Thank you for joining us.
Thank you very much, Dr. Cromwell, for having me, and thanks to Dr. Jamila for coming on the show. At this point, we're going to give some update on COVID-19 vaccination cases around the world. So I'll just go straight into it. Basically, the number of cases around the world has reduced drastically, making it a little bit of some kind of progress in terms of cases. However, we look at vaccination rates around the world, especially in third world countries, that doesn't seem to be going in the right direction. So if you look at the demographics of cases per 100,000 people for the past 7 days, you can clearly see that the areas that are driving the numbers are in the United States, part of Russia, and the European countries. If you look at Ghana, for instance, the past 7 days, average number of cases is standing at over just a little bit over 400 cases within that period of time. And we do know that if you do the 100,000 population, you have like one person being reported. That doesn't mean that those are the real actual numbers. And again, you have to exercise caution because the data from Ghana is always behind about 5 days. In terms of casualties, the number of deaths, if you look around the world, you still see similar trends. However, you do see that Russia and the United States and parts of Africa, or the northern part of Africa, seem to be driving the numbers in number of deaths. And when you look at Ghana, again, the data is a little bit behind, but the 7-day average reporting for number of deaths stands at 5 at this point. Now, going into the number of deaths arranged for the past 7 days, this recent week, the United States still lead in the number of cases, only a few numbers shy of 10,000 deaths. Certain areas, especially like in Africa, also suffering, especially Namibia, is struggling with number of deaths and cases as well. This graph just basically tells us that, yes, we're seeing a decline in number of cases and corresponding decline in deaths, which amounts to about 15% in the United States. It still doesn't show that we are making a tremendous change in terms of number of cases, but it's significant in the sense that these numbers, 15% is not something that we would take lightly, right? It's something good. So yes, we are heading in the right trajectory. We are coming down the hill or the peak, but at the same time, we should make sure that we get vaccinated and also extra sort of protection. You're wearing your mask when you go out. Now, this is something that I took to just basically tell our audience and those who are listening that when you come to the United States, the areas or the different counties have been classified all the way from high incidence of COVID-19 to low incidence of COVID-19. And therefore, it's just kind of a weather kind of outcast over there, or forecast, I should say, that shows you the area that you're visiting and the number of, or the high transmissibility that is associated with that area. So for instance, if you look at the Cook County, currently our positivity rate stands at 1.6%, which is good. Anything below 5% is acceptable, and therefore that's something that we all look out for. One thing that we should also be cognizant about is the variant of interest. Okay, so this variant of interest, or variant of investigation, is Delta Plus, which is just a little bit tiny modification or mutation of the current Delta variant. It is accounting for some cases in the United Kingdom. It hasn't really caused a lot of havoc as we speak. So it is classified as a variant of investigation or variant of interest at this point. If you look at the trends in vaccinations around the world, we realize that over 49% of the world population have received at least one dose of the vaccine. Unfortunately, only slightly above 3% of third world countries or low-income countries have received one dose of that vaccine. Now, the reason why we are pushing the vaccine is that for individuals who are vaccinated, have at least 11 times, they are 11 times more likely not to die from COVID compared to their counterparts who are not fully vaccinated. Now, if you look at countries around the world, United Emirates lead in the number of vaccination efforts in terms of percentages. which spans all the way to Nigeria, standing at 2.6%. Now, again, if you focus in the United States, we do see an interesting trend in the sense that even though among the vaccinated individuals, you still see some percentage of breakthrough infection of about 4.5 in every 10,000 people. We still see breakthrough infections. So you have to be very cautious, especially if you have immunocompromised conditions. If you qualify for any booster shot, you should think about getting it as well. And then, some great news came during the month of September and October, where Pfizer and BioNTech vaccines were approved for certain populations in terms of booster shots. Also, the Moderna and Johnson & Johnson were approved recently, also as booster shots. So again, if you look at the number of people who are vaccinated in the US, and if you kind of categorize it into what type, the Pfizer BioNTech 2 doses, and Moderna 2 doses, and Johnson, you can clearly see that the RNA vaccines are leading in the number of people who are vaccinated. However, when the booster shots were approved, we've seen that there's an uptick in number of people who are getting the Pfizer and BioNTech vaccines. So who qualifies for the booster shot? So this has been a very interesting discussion recently. So if you received a Pfizer and BioNTech Moderna vaccine, if you're 65 and up, you definitely qualify for the booster shot. The reason being that at 65 and up, your immune system is not as strong. You're likely to be at risk for severe infection or severe disease, and therefore it's approved in either case, whether Pfizer or BioNTech for that matter. If you're 18 years and up to all the way to 65 years, and you work in a long-term facility, or you're actually in the long-term care facility, then you can also get the BioNTech or the Pfizer or the Moderna vaccine as well. If you're 18 years and up, all the way to 64 years, and you have a high-risk disease, you also can qualify for it. However, Johnson & Johnson has been approved to be given for any individual who has received their shot, the single-dose shot for them after 2 months later. However, for them, they don't have any cap on who should get it. Anybody who is 18 years and up can get a booster shot at this point. So again, let's look at some of the basic, or some of the, I would say, the categories of individuals who qualify for booster shot. The first responders, healthcare workers such as Dr. Cromwell and Dr. Jamila will definitely qualify for this at this point. Education staff like myself, those who are exposed, have a higher chance of being exposed to COVID-19. Also, food and agriculture workers who are working in manufacturing, correction officers in prisons, and even the prisoners themselves, postal service workers, transit workers, and then grocery store workers. These are individuals who will qualify for the booster shot. Now, can you mix and match the vaccines for booster shots? Yes, the answer is yes. There's been a push to get actually the RNA vaccines, in the sense that they have been shown to be more efficacious than the J&J vaccine. But all of them are good. If you want to stick with the J&J, it's also something that has been approved by the Food and Drugs Administration. Now, is there an approved FDA COVID-19 vaccine for children? So the CDC has put up, on the FDA has put up an announcement that the US Food and Drugs Administration has not authorized any COVID-19 vaccine for children 5 years to 11 years of age. We are still waiting on ACIP to give us the go-ahead to do that, because again, Pfizer has presented some, compelling data to support that children 5 years and up to 11 years can actually benefit from COVID-19 vaccine, but it has not been approved as we speak at this point. Now, if you go back to our homeland Ghana, our country Ghana, we do see that there's been increase in number of vaccinations from the last time we reported. Ghana is part of the COVAX program, and we are looking to COVAX to provide us about 10% of our population being vaccinated. At this point, we stand at only 6% of people that have received at least one dose of the vaccine. We received recently, I think a week or two again, we received over 2 million doses from a group of countries, including Ireland, Germany, and Norway, that contributed to about 2 million doses for that matter. Also, the United States, as of now, has contributed about 2.5 million doses to the Ghanaian community, and we appreciate all these efforts. to get the people of Ghana vaccinated in that regard. And again, the vaccine that has been sent by the COVAX is from AstraZeneca, which is a Covishield dose. So again, there are more COVID-19 vaccines that's going to arrive in Ghana. We hope that the countries that have excess or be able to give us some of these doses will benefit countries such as Ghana and Africa as a whole. So on that note, I would like to, pause there. And if you have any question that you want to ask me, you can go ahead.
Thank you very much, Dr. Corey. And one of the first questions I was going to ask you was about mixing the vaccine. So I'm so happy that you emphasize on that, because a lot of my patients are very nervous. A lot of people who are homebound were only getting the Johnson & Johnson just because it was easier for the fire department to bring it by. So they were concerned about getting their booster shot. So you're saying that people who have the Johnson & Johnson can get either the Pfizer or Moderna, or does Moderna already have their booster shot available?
Correct. So Moderna also has the booster shot under the same kind of guidance. Okay. That was approved later than the Pfizer, but it's the same kind of classification as the Pfizer vaccine booster shots, right? So you can mix and match. You can use Moderna, you can use Pfizer, or you can stick with your J&J.
Okay. Now, does J&J have their booster shot available as well?
At this point, yes. If you,
for everybody, okay.
You can get that too, yes.
Okay. And then tell me a little bit about the fourth shot. I was getting ready for work one day and I heard someone on the news say that we may need a fourth shot. And I thought, oh my goodness, I'm begging my patients to get the third one. So how does that work?
Right. So like the same way we said that after 6 months, the one that from Pfizer and BioNTech starts to wane in terms of the immunity or the protection, we anticipate that going forward, there are individuals who are going to start to need that. So this is kind of like the flu vaccine, right? The only difference is the flu at least comes seasonally. This one, we don't have that option, right? So we anticipate that. But for now, what data has shown is that if you receive the third dose, you tend to generate enough response in terms of your antibodies production, which should be able to cover you for a lot of months. We don't know as of now how many months it will take, but we do know that it will offer you some protection for some time. For a fourth dose, we haven't really thought of it at this point. We are focusing on getting booster shots to individuals who qualify at this point.
That's what I thought. So when I heard it on the news, I said, oh my God, that's too soon, the fourth shot.
Right.
So tell us a little bit about, the holidays are coming, right? People are planning to get big family gatherings for Thanksgiving and Christmas. What are your recommendations in terms of people getting together with people in terms of social distancing?
Correct. So, we realize that if you look at the peaks and troughs of COVID-19 cases, we realize it actually correlates very well with holidays, right? So whenever there's any holidays, people tend to kind of relax, get together, have fun and all that kind of stuff. We are seeing some breakthrough infections among vaccinated individuals. The only good news is that the number of deaths amongst them is kind of minimal compared to the over 97% of people that die who are unvaccinated. So we still advise that you keep an extra level of protection, which is if you can social distance, please do. If not, you wear your mask when there's too much people around and you cannot even trust their vaccination status or their COVID-19 case status as well. One life lost is too much at this point. So we would like to advise that you still exercise caution because this is an evolving thing. We don't want you to be on a ventilator or be in a hospital because maybe someone passed the virus to you, even though you're vaccinated, especially among individuals who have risk factors, right? Those who have some underlying conditions that makes them high risk for severe disease. So we advise that you exercise caution as you go on break. And then one more thing, as you travel, if you're going to countries where, like I mentioned earlier on, you have to look at the transmissibility in that country, especially if you are not vaccinated. It's just disheartening that a lot of our Ghanaian folks have not vaccinated. A chunk of them haven't. So we want you to be cautious as you travel to other countries. Maybe in Chicago, the transmission rate is probably maybe a little shy of 2%. That will not be the case in another country that you go to. So make sure you check that before you travel.
And that was my next question, because you know that Christmas time brings a lot of travelers to Ghana. So what is your recommendation going to Ghana through this holiday season?
Right. So existing and presenting data from Ghana suggests that our transmissibility there is really low, and we tend to be a safe place to travel to. I'll continue to rely on that information at this point. I will still urge listeners to be cautious as they go to Ghana. As I mentioned earlier on, sometimes our data is a little bit behind, and you can tell in the event of Delta transmission, 7 days is too much time for you to know the actual transmissibility in that country. If you're not vaccinated, I will advise you to get vaccinated before you leave, or if you go there, you make sure that you wear your mask wherever you go, because we're still seeing cases in Ghana. Even today alone, we registered over 200 cases in Ghana. One person died from COVID. So it still tells you that there's still COVID in Ghana and it's spreading.
Absolutely. And Dr. Ofori, I've seen less information pertaining to the statistics in Ghana. Prior to, I'd say probably about 3-4 months ago, we were seeing it daily, through the Ghana Health Services. So why do you think they're not really telling us what's going on? Because some of us are preparing to go back home, and I know a lot of people watching are have already bought their tickets and they're going back home. So I mean, what should we think about that?
Sure. So again, I will say that the management of COVID-19 in Ghana has suffered a lot of and everywhere else, even in the US, has suffered from political influences. This is a public health issue. I will understand that it will be a top priority for the Ghanaian leadership to institute some kind of screening at especially Kotoka International Airport, even though we don't really have any what we call zero prevalence studies going on currently. We don't really see much contact tracing at this point. We will still encourage folks who are going back home to exercise a lot of caution. We don't see the data forthcoming because the testing, in my opinion, hasn't been forthcoming as well, at least for Kotoka International Airport, because you have to display or show that you've tested negative 72 hours before you go, tend to give some, oomph to the data. But at the same time, I will understand that the Ghanaian media and the Ghana Health Service and the leadership should do better in terms of putting up this information out there. We should focus our attention on it because the fight is not over, especially when you only have 6% of your population immunized.
Only 6%. That's really something. So everyone, you've heard it here first. Dr. Ofori is encouraging us all, if we've already purchased our tickets to go to Ghana, make sure that we are vaccinated and also that we are wearing our mask and just practice trying our best. It's kind of hard to practice social distancing there. Everyone is so close-knit, but trying our best to stay as safe as possible. We'll transition a little bit to the community health and Community Ghanaian Health Clinic. It's such a new word to get used to, but
right. It's a mouthful.
A big mouthful. As you being the pharmacy director, go ahead and tell our viewers what they can expect when they come on November the 13th.
All right, so we are very excited to have that community health awareness program happening, kind courtesy of the Ghana National Council in collaboration with the healthcare team that Dr. Jamila, Dr. Cromwell, myself are part of, and of course, Dr. Hodebe, who is also part of us. We are a great team that is putting this into place so that we can help our Ghanaian community in Chicago. And again, we also will encourage you to participate to make this a success, right? So in terms of pharmacy and pharmaceutical healthcare delivery, we want to provide the best counseling, okay, on your medication, because we all understand that you can get the best out of your medication if you really know how to take it and you take it consistently, and also be able to avoid any kind of drug side effect profiles that are unwelcoming for certain individuals. We'll be able to review them for you through the brown bag review as well. We also encourage you that when you come, we can also talk about alternatives to your medication, review your medication history, and be able to optimize your therapy or your treatment so that you can get the best out of your medicines that you take to manage your conditions. We also offer preventative health advice through all the healthcare professionals that you're going to have there. We will offer some preventative healthcare delivery as well. on that particular day. So please make sure you mark it on your calendar to make sure that you attend this all important healthcare awareness campaign.
Wonderful. And we are all excited once again to serve our community. We hope that the whole place will be overfilled and we'll have to put people even in the hallway. We are very prepared for everybody, by the way.
We will social
Yes, we're very prepared. Dr. Afori and his team will be there. Dr. Jamila, Dr. Prince, myself, Dr. Habiba. We have a slew of nurses that are coming to help us do everything. So please don't feel like you're not going to be in place. As Dr. Afori said, bring all your medications. One of the benefits of having a pharmacist is to really go through everything, look at side effects from medication, and also make recommendations as to how you can optimize and maybe change the way you're taking some of your medications. So don't miss November 13th. That's going to be at the Methodist Church. We've heard our message from our medical director a number of times. We'll probably play it before we end the show again, but please make sure that you are at Methodist Church November 13th at 11 o'clock to 3 o'clock. Tell a friend to tell a friend that the Ghanaian Health Community Clinic is open. Dr. Foy, I'll go ahead and give you a chance to give your closing remarks.
All right, so I'd like to express my sincere gratitude to anyone who tuned in this evening to listen to our show. I'd like to thank Dr. Jamila for opening the show and giving us this great information about breast cancer and its awareness month. We are very enthused about our health outreach program as well. We encourage all listeners to come November 13th to kind of grace the occasion and make it more successful so that we can continue to keep this community clinic going because we want to provide healthcare to individuals who are disadvantaged or for some reason don't have access to primary care in terms of health. So again, we would like to thank you. If you haven't gotten vaccinated, please don't think about it twice because you can either get the immunity from getting the virus itself, or you can get it from the vaccine. But I know for sure the vaccine is protective. The virus could potentially kill you. So at this point, I would like to thank everyone and thank the host, Dr. Cromwell, for the great work that you've done. I would like to thank the production team, of course, Black Jesus. Thank you for having, getting this platform going and everything being successfully run. Thank you very much.
Absolutely. Thank you very much. We'll take a quick break. And when we come back, we'll go ahead and take a few community announcements, and then we will wrap up the show for today. I'm Dr. Araba. Stay tuned.
Looking for that special gift for that special someone? Looking to bring life into your personal or family portraits? Art Bank is your creative bank of art solutions. We provide a wide range of digital photo editing and paintings that will transform your images into exquisite yet affordable pieces of art. We bring old photos back to life. Your photos can be framed or made into canvas prints of any size of your choice. Our ultimate goal is to bring into your homes and offices amazing masterpieces through eye-catching portrait paintings for occasions such as birthdays, graduations, award ceremonies, funerals, and many more. You can locate us on Instagram at @bankgh. You can also contact us on 312-609-9907 or @bankgh@gmail.com for all your inquiries. Art Bank, reviving your images.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for everyone that has stayed tuned to participate in our program, Health Talks on Trend Africa TV. Remember, Trend Africa TV, in conjunction with Ghana National Council, brings Health Talks to us every Thursday from 6:30 to 8:30 p.m., where we engage many professionals. We also look at a lot of health products, and we promote a lot of things on this program as well. If there's anything that you would like for us to show on this program, please let us know by contacting us via WhatsApp only at 773-312-0318. Or you can send us a message on Ghana National Council's Facebook or Instagram together with Trend Africa's Facebook or Instagram. We'll take a few announcements that we have for our community. First and foremost, Ghana National Council has a very functioning website, and if there's something that you would like to promote, please let me know. As business manager, we do have many, many affordable rates. My phone number is 773-526-9493, and I'll be more than happy to help you accommodate any of your business ideas to promote it on our website. Next, we do have a collaboration with the Tree Learning Center. So for those of us who want to travel back home in December and you want to brush up on your language skills, you can take language classes for either Tree or Fanti and get 10% off using the GNC code, which is TLC-GNC-21, and you'll get 10% off on your Tree or Fanti lesson. These are both lessons that can be either group or individual. If you have any questions, you can contact me. I am a faithful student. I've been taking Fanti lessons for almost 4 months, and you can definitely contact me for your discount, 773-526-9493. Also check them out on Facebook and Instagram. In terms of health insurance needs for our people back home, the number one thing to choose would be Fleary Health Insurance. We did hear a little bit earlier from the CEO, Mr. Sam Badu, but Fleary Health Insurance is a health insurance remittance company. It allows us who are living here to pay for health insurance policies for those who are living back home. So their motto is to give loved ones back home in Africa the gift of a better life. It's a health care coverage plan that definitely works. This plan covers doctor's consultations, dental and optical and lab work, prescription delivery, and also covers ambulance services, which is very, very important for back home. They also have travel insurance. So let's say that you wanted to travel to Ghana for maybe 2 or 3 weeks. You could purchase travel insurance through Fleary and make sure that you are going to be well taken care of when you travel back home. Learn more about Fleary by visiting the website at www.joinfleary.com. Also, if you are in Ghana, and for those of us who have family members back home, we're always so concerned about them. If you needed a physician to go and visit your loved one at home, the only place to look would be Express Med GH. They do have a telehealth aspect, and they also have capability to go to your home to visit you, do blood work, and keep up with your medical care. You can call them via WhatsApp on 054-2053-335 or 020-2660-061. Visit them on their website, www.expressmedgh.com, or send them an email at expressmedgh@gmail.com. We also have Art Bank. Art Bank is one of our proud sponsors, and they provide digital paintwork. This month, they have a special promotion, which will be ending on Sunday, but you can receive 15% off on beautiful artwork. They take some of your old pictures and they redraw it, and you can hang them up on your house. You can use it to give it away for any occasion, graduations, outdoorings, birthday. There've been a number of people that have done it for memorial reasons in terms of funeral. But you can reach them at 312-609-9907. Art Bank is part of PA Ventures. So you can also send an email to pavventuresLDT@gmail.com or pakwecisam@gmail.com. Make sure that you choose them as the holidays are coming up. You can purchase something and give somebody something very, very beautiful for Christmas. BDAN Dental is also a service that we interviewed maybe about 3-4 weeks ago here on our program. And they also have a wonderful promotion going through October, which will be ending again on Sunday. They are asking people to call and you'll get 10% off on your cleaning. This is a mobile dental clinic that is primarily available in Accra. So for your loved ones back home, plus 233-24894-7951. You can reach out to them and they will come to your place and provide you a cleaning at 10% off. And that goes through October of 2021, which will be ending once again on Sunday. Trend Africa TV is able to provide all your media needs. We do have access to cover your programs live. We do have a radio station. We are in conjunction with Holiday Africa. We have lots of amazing things going on. So if you're having an event and you want to make sure this event goes worldwide, don't look any further but to contact Trend Africa TV. Now, in order to bring our programs and everything to you, things cost money. So I do want to encourage us all to donate to Trend Africa TV so we can continue to bring about these wonderful programs, and we can also be able to provide services to the Ghanaian community. You can donate to Trend Africa TV via Cash App, which would be the $ Royal Black Jesus, or Zelle, once again, to our phone number, which is 773-312-0318. We thank you once again for your support, and we always look forward to bringing you the most important information, whether it has to do with entertainment, sports, or healthcare. After skin cancer, breast cancer is the most common cancer diagnosed in women in the United States. Breast cancer can occur in both men and women, but it's far more common in women. Substantial support for breast cancer awareness and research funding has helped create advances in diagnosis and treatment of breast cancer. Breast cancer survivor rates increase at a number of deaths associated with the disease and steadily declining, largely due to its large number of early detection and a new personalized approach to treatment and a better understanding of the disease. One other announcement is Africa and Beyond for all your family and event bites and needs. They have their phone number at 773-712-5036, or you can contact them via email at africaandbeyond22@yahoo.com. They do accept Zelle payments, and you can go ahead and order all your tasty treats for any program that you may have in mind. The goal of the Ghanaian community and the healthcare professionals in Chicago is to provide our community with regular source of healthcare and have better health and fewer disparities. With this, we are sure that our patients are more likely to receive preventative services, identity of chronic conditions earlier, which will result in better outcomes. Make sure that you stay tuned to Trend Africa TV and watch Health Talks every Thursday from 6:30 to 8:30 p.m. Once again, if you have any topic that we have not addressed, kindly send your information in so we can be able to find the expert that will be able to find that topic for you. My favorite quote, of course, is, remember, if the sun is not shining on you, let it shine through you. I'm Dr. Araba, and I look forward to serving you on November 13th at Methodist United Church from 11 a.m. to 3 p.m. Tell a friend to tell a friend that the Ghanaian Health Community Clinic is officially opened, and we are here to service you. Until next time, I am your host, Dr. Araba. God bless you, and God bless our homeland, Ghana.
Hello there. Welcome to Trend Africa, where we give you the best of live streaming across all states in the US. We also do web designing, event planning, emceeing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1 773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store.